let's go on to Florida. Pushes forward to ban gender-affirming care for Medicaid users. Hoy, what's going on here?
So, Florida's Department of Health is now weighing banning coverage for gender affirming care through the state's Medicaid program. Um, Florida Surgeon General Joseph Lombardo had recommended against providing medical care to transgender youth if it involves transitioning, which included social, medical, legal. If it involved any type of transition, he said it should not be allowed. Now, the Agency for Healthcare Administration released a report last month saying that gender affirming care for any patient should be classified as experimental and investigational and recommended not allowing Medicaid to cover such care. If the state adopts the recommendation, that means that Medicaid would no longer be able to cover puberty blockers, hormones, hormone antagonists, gender affirming surgeries, or any other procedures that alter primary or secondary sexual characteristics.
Would that also include gender-affirming mental therapy, mental care?
That's where things get really dicey because mental care is not necessarily coded, such as if
Mm,
you're in therapy, that doesn't, it's not coded separately for trauma therapy, family therapy, or
gender therapy. Okay.
gender therapy. It's basically just therapy. But if we begin to see state run Medicaid branches cutting off access to gender affirming care, it is very likely that we will see private insurance beginning to cut off access to gender affirming care coverage. And in that sense, Medicaid is just insurance covering the care. Private insurance follows the path of Medicaid. So when we look at this, we should be very alert. Any state that begins to talk about tweaking the Medicaid program to not cover gender affirming medical procedures, that is code for this is a movement to force insurance as a whole to stop covering gender affirming care.
Mhm. Yep, it's the erasure of trans care in the United States.